So today we will, in short, tell you what is important about fracture neck of talus. You see, as the foot dorsiflexes, the anterior margin of the lower end of tibia strikes against the neck of talus and fractures it. Now, the talofibular ligament would pull the body, the proximal part, the body into complete plantar flexion, Therefore, reduction of fracture neck of talus is always done in complete plantar flexion. After 3 to 4 weeks, you can regain the plantar position. There is the blood supply of the body of talus is from the sinus tarsi, and therefore it's a very poor blood supply. If there is an associated dislocation of the subtaloid joint or the fracture is proximal, the blood supply is compromised and there's a high chance of avascular necrosis. So after this, if the body dislocates, it would dislocate from the tibio-talar joint and it will dislocate from the subtaloid joint. And this body would actually come medial, posterior to the sustentaculum talli into the porta pedis. So here the body has gone into the porta pedis, and when the body goes into the porta pedis, it presses on the posterior tibial artery and the posterior tibial nerve. The pressure on the posterior tibial artery can lead to gangrene. The pressure on the posterior tibial nerve can lead to an aesthetic foot. And it can press on the skin and cause pressure necrosis in the skin. So this is an emergency and this body must be reduced into position as soon as possible. After understanding this, if the body becomes avascular, the body is excised and an anterior sliding graft from the anterior surface of the tibia is slid into the neck of the talus. This procedure is called as Blair's field. And finally, if there is osteopenia, subchondral osteopenia, it is called as Hawkins sign positive, and it has a 50% specificity that the avascular necrosis would not occur. However, in this you can see some sort of sclerosis which increases the risk of avascular necrosis. So this is all that I want to tell you.